Hi everyone, I'm Teles, physiotherapist from Brazil, and it's a great pleasure to be here today to share with you the preliminary results of one of our studies, our randomized clinical trial. These are our disclosures. And from previous studies, we already know that the non-ablative radiofrequency is a safe, low-cost, and innovative therapy that can be used for the pelvic floor dysfunctions, including the anal incontinence. The way that the radiofrequency acts in the tissue is especially increasing the synthesis of collagen type 1 and the relation between the type 1 and the type 3. What also increases the elastic resistance to the traction to this tissue specifically, and increases the stability. And we also know already that there are morphological differences in the sphincter, anal sphincter with the radiofrequency. This is the first study that has as a goal to verify the manometric and the clinical responses of non-ablative radiofrequency to treat anal incontinence in women. Then this clinical trial, this randomized clinical trial, had as an inclusion criteria women aged between 18 and 65 years old that had a complaint of anal incontinence that could be proved by the index of fecal incontinence, and that had the muscular strength at least of 3 according to Oxford scale. This that couldn't understand the questions or the therapy itself, or had hemorrhoidal disease, metallic clamps in the area, or were pregnant, were excluded. The initial evaluation of these patients included anamnesis, physical evaluation, anorectal manometry, and other evaluation for severity of incontinence, quality of life, and the impact that they would feel about the anal incontinence they had. We need to reach the amount of 46 patients for a sample size that would be adequate for our study. And in the randomization, we had the radiofrequency group that had the radiofrequency used once a week for 5 sessions, together with the pelvic floor muscle training. The control group would have the radiofrequency off on the sham mode with the gel heated for them to believe that the radiofrequency was on, combined also with the pelvic floor muscle training once a week, 5 sessions. The pelvic floor muscle training, both groups would do also at home. And the follow-up was done 1 week and 1 month after the end of the treatment, and all the re-evaluation of the patient was made. This is the machine that we used. It's a monopolar radiofrequency, so the passive electrode was placed under the hip, and the active electrode was used in the perianal area of the patient. Once we could reach the temperature, we would keep it for 2 minutes. It's possible to see in the results that the radiofrequency group till now has 7 patients and the control group has 8 patients. And on the baseline, we don't have a statistical difference between the sociodemographic and clinical characteristics of the patients. When we analyze at the end of the treatment, 1 month after the treatment, the radiofrequency group had less patients and less frequent gas losses than the control group. And when we have the evaluation of the manometry, specifically the rectal capacity has changed in the radiofrequency group with an increase that was statistically significant, as when we make the comparison between the radiofrequency group and the control group. The difference was important. With this, it's possible for us to conclude that the non-ablative radiofrequency on the perianal area showed promising results for the passive incontinence for gases and significant increase on rectal capacity, what brings us the hypothesis that it could be also a good treatment for patients that have urge incontinence, for fecal urge incontinence, and also reduction of the rectal capacity. Thank you very much.